Have you ever been offered a Medicare Advantage plan with a zero premium and thought, wait a second, how can that be free? If so, you're not alone, and today we're going to clear it up for you. Hi there. If we haven't met yet, I'm Danielle Roberts, Medicare expert and co-founder here at Boomer Benefits. In this video, we'll explore why Medicare Advantage plans may cost less than Medigap plans, how some of them can have zero premiums, who pays for the plan, and what some of the costs are that you will pay if you enroll in a Medicare Advantage plan. You'll discover that while some plans have a zero premium, they are definitely not free. Even Medicare itself will never refer to them as free. Stay tuned until the end to grab our guide on Medicare Advantage versus Medigap plans so you can explore the pros and cons of each option. Let's talk about what Medicare Advantage actually is. The Medicare Advantage program was designed to give beneficiaries an alternative to original Medicare that you pair with a Medigap plan. Not everyone can afford Medigap insurance, and Medicare Advantage offers lower premiums if you are willing to abide by the plan's conditions and use the plan's network of providers. When you join a Medicare Advantage plan, your providers no longer bill Medicare for your healthcare services. Instead, they bill the Advantage plan. This transfers all the medical risk away from Medicare, and Medicare is willing to pay for that. Medicare pays the Medicare Advantage companies somewhere around $1,000 a month to take on your medical risk, and it can be more than that with bonuses. Medicare Advantage plans can offer low or $0 premiums because they're getting paid by Medicare. That money covers their costs so they don't have to charge you a high monthly premium, but the plan still isn't free. In some urban areas, you can find plans with a zero premium. This means that when you join the plan, you don't pay any monthly premium for the plan itself. But as I shared, this doesn't mean the plan is free. It simply means that Medicare is paying the plan to take you on as a member. So what are your costs then? First, you still pay your Medicare Part B premium to Social Security each month because Medicare is still paying for your care. It's just now paying for it in an indirect route through an Advantage plan. Second, you are responsible for paying the plan premium if there is one. And as I mentioned, some plans charge zero, but many charge more than that. And due to some of the unintended consequences of the Inflation Reduction Act, more Medicare Advantage plans are beginning to charge a small monthly premium for their plans. These plans should still be considered because a zero premium plan isn't necessarily the best plan for you. There are other very important factors that you must consider when choosing a Medicare Advantage plan, such as the provider network and the drug formulary that's included in the plan. Does it include your preferred providers and necessary medications? If not, that plan may not be a good fit regardless of how low the premium is. Third, when you are enrolled in a Medicare Advantage plan, you will still pay out of pocket for your copays, deductibles, and coinsurance as you use the plan's healthcare services. Your agent will provide you with a summary of benefits that details everything that you pay as you go along. It could be that you pay $30 or $50 each time you visit a specialist, or if you go in the hospital, maybe you pay $200 a night or more, depending on the plan. The part that is probably most concerning to many people is that Advantage plans will often have you pay a 20% coinsurance for things like chemotherapy, radiation, and dialysis. For example, we had clients sign up for a zero premium plan thinking it would save them money, but later found out they're facing thousands of dollars in coinsurance costs after starting chemotherapy. It's a huge surprise if you're not prepared for it. When a healthcare service costs you 20%, you'll pay that 20% yourself until you hit the plan's maximum out-of-pocket limit. This is the maximum annual limit on how much you'll spend on Part A and B services during any calendar year. So that's the most you could spend in a calendar year. But that's a lot of money for people living on a fixed income. Your Part D expenses like copays and deductibles are separate and additional as well. Keep in mind also that the summary of benefits for your plan is only good for 1 year. Advantage plans can and do change their plan premiums, copays, and coinsurance from year to year. You'll want to review your annual notice of change that they send you each fall so you can see what's coming and use that opportunity to switch Advantage plans during the annual election period if you don't like the changes for next year. So, are zero premium Medicare Advantage plans ever really free? Definitely not. You will pay for Part B every month, just like you always have. You'll pay for the plan's premium, if there is one, and you will pay some cost sharing as you go along and you use various medical services. Keep in mind, too, that if the plan is offering to let you join and pay absolutely nothing, you might find that the copays and coinsurance you pay for medical services on that plan are higher than if you had joined a plan that did charge you a monthly premium. So the moral of the story is that when it comes to Medicare, there's no free lunch for most people. The only way that you might pay nothing out of pocket is if you are a low-income person who is eligible for both Medicare and Medicaid. Medicaid will then step in to pay for some of your deductibles, copays, and coinsurance, either on your original Medicare benefits or on some Medicare Advantage plans that are specifically designed for low-income individuals. But for most people, Medicaid won't apply, which means the costs we've talked about today are what you can realistically expect to pay out of pocket. All of this doesn't mean that a zero-premium Medicare Advantage plan is bad. It's just not free. And around here, we like to be very honest with our prospective clients about the plans that they are considering. We find that if someone knows and accepts these risks up front, they are far happier with their plan in the long run because there's no surprises. We know Medicare can be confusing, but you don't have to figure it out all on your own. Our team is here to help, and it all starts with understanding what's really included in your coverage. Be sure to download the free guide below. It's a great comparison that lays out real-world costs of both options in an easy-to-understand format. If you want to learn more about Medigap plans, watch our Medigap pros and cons video next.